Severe weather events resulting from climate change is leading to more threats on global health. These are linked to the lack of clean air, drinking water, or food supplies, creating grounds for outbreak and disease epidemics. Dr. Maria Guevana from Doctors Without Borders sounds the alarm on its impacts to our well-being.
So what's predicted, I think, I believe from 2030 and 2050, in this time period, the WHO says we're probably going to face 250,000 more additional deaths per year. So from MSF's perspective, as a global medical humanitarian organization, we've already been dealing with these health emergencies on a constant basis. So it's now also more evident that there is a relationship with climate change, as we're seeing it get more and more unpredictable, severe in breadth, more frequent, and huge sizes of outbreaks. This year, for example, in the wake of COVID, so COVID in itself, as an emerging infectious disease of zoonotic origin or animal origin, this has created a huge repercussions or collateral effects on the health system. And that begets more outbreaks like cholera because of all this insecurity. So now we through the last couple of years, we've seen a huge spike in cholera outbreaks in at least 30 countries around the world, with many who have not seen it for over decades are now seeing it again. So it's just a domino effect that climate change has put on the table.
Urgent action is required to mitigate the growing global health risks from climate change. Dr. Maria explains how failure to act now would further affect the Asia-Pacific region.
Taking into consideration, climate change is also a natural phenomenon, but because of human activity impact that has skyrocketed in the last through the Industrial Revolution to today. And that impact is hitting Asia Pacific. And so the heat stress is increasing, which will be impacting Malaysia a lot. More floods, more uneven floods and droughts experiences are also going to impact Malaysia.
Innovation, said Maria, is required to better respond to ongoing climate health emergencies.
One of the things we could probably consider innovating with Malaysia, for example, is how do we address dengue? So I'm going to jump to Honduras. This is where we're also working on addressing dengue, for example. And there we have just recently launched with the government what we call the Wolbachia infected mosquitoes. So we had created the breeding of mosquitoes that are infected with this bacteria of Wolbachia, which makes them less prone to transmit dengue. And hopefully, in generations in the next year or so, the next generations of mosquitoes won't be able to transmit dengue, and therefore maybe hopefully decrease the risk of dengue fever outbreaks. And that's something that we could consider as an innovative kind of targeted vector control, for example, in Malaysia, to address these kinds of risks that may be posing for the Malaysian populations.